All right, we're going to go ahead and get started. Good afternoon, and thank you for joining us today for the PrEP 101 Building Confidence with Clients and Patients webinar, hosted by HCET with presenter Leo Parker. My name's Bailey Schroeder. I'm a virtual training manager here at HCET, and I will be moderating this webinar today. First, let me briefly introduce you to healthcare education and training. HCET's mission is to provide comprehensive program development, education, and training to improve reproductive and sexual health outcomes. HCET is an organization of passionate people who are proactive in their belief that access to evidence-based, medically accurate, reproductive and sexual health education, training, and care is a fundamental right. This webinar has closed captioning available, so if you'd like to turn that on, you can enable them on your screen by clicking the live transcript button at the bottom. Then you can click show subtitles and change the settings however you'd like. For more information and to keep up to date with HCET events, please be sure to follow us on these social media platforms and visit our website, hcet.org. To learn more and to have more trainings and professional development opportunities, visit our virtual learning site at learn.hct.org. Just a few more housekeeping things. A link will be sent with an evaluation at the end of this webinar. Your feedback is greatly appreciated. You can also find archived presentations and a list of upcoming events at our website. If at any time you have technical difficulties during the presentation, you can email me at the email you see here on your screen. Then for nursing contact hours, if you would like to receive these, you need to be sure to attend this entire webinar, complete the event evaluation, and submit the nursing contact hours form to Kelly Bradford at the email shown here. That information will also be in the thank you email that comes out after this. All right, no one with the ability to control content of this webinar has a relevant financial relationship to disclose with any ineligible company. Throughout this presentation, we encourage you to send questions via the chat box. You can do that by just hovering over the Q&A there at the bottom of your screen. Then a chat box should appear on the right side of your screen. You can send those anytime during the presentation, but we'll just, I'll collect them, and then at the end we'll do a Q&A. So we'll get to those at the end, but feel free to send them throughout the presentation. All right, now I would like to introduce you to our presenter today. Leo Parker is a highly motivated healthcare advocate with over 20 years of experience in the education and prevention of sexually transmitted infections and HIV. He currently serves as a director of prevention programs with NCSD, where he provides technical assistance and capacity building to its members. His vast experience includes serving as a CDS project manager at Georgia Department of Public Health, health administrator at the Fulton County Board of Health, and state STD director at the Tennessee Department of Health. His career path has been spent in STD HIV prevention, where he started out as a program coordinator for one of the largest AIDS services organizations in the Southeast, and transitioning later as a disease investigator for the Georgia Department of Health. His experience and wealth of knowledge has afforded him the opportunity to present at numerous national conferences, as well as serve as an expert panelist on various topics. Leo's love of healthcare began at Georgia South University, located in Statesboro, Georgia, where he received a Bachelor of Science in Health Sciences. Without further ado, I will be turning things over to Leo.
Thanks so much, Bailey. Good afternoon, everyone. And I'm going to attempt to share my screen. And does everyone see my presentation without my notes?
Yep, you're good to go.
Okay, great. As Bailey just introduced, my name is Leo Parker, and I'm the Director of Prevention Programs for NCSD. Today's presentation will focus on the basics of PrEP and PEP. If you have a question, as Bailey mentioned earlier, feel free to drop it in the chat in the Q&A, and our goal will be to get to those questions at the conclusion of the presentation. One thing that I would like to note is that I am not a medical professional, so there are some questions that I may be unable to answer today, but I am more than happy to do the necessary research to provide the answer to Bailey after today's presentation. So as with any training, I always like to set some objectives. This will also give us an idea of the information we will cover today. Today's objectives is 1, to gain a basic knowledge of PrEP and PEP. How to start culturally appropriate conversations about PrEP and PEP with providers and clients or patients. And then lastly, how to identify clients who can benefit from PrEP. Before we get into what is PrEP, I want to take a minute just to look at some of the PrEP data that is available. As the graph on the left shows, approximately 1.2 million people can benefit from PrEP. However, we see only a small percentage is taking advantage. On the right, we see data from a 2017 MSM study where 80% of the men were knowledgeable of PrEP. However, 60% were willing to go on PrEP and only 20% were using PrEP. And hopefully by the end of today, we can get into like some of those reasons why people are aware and they have a willingness, but the numbers of people who are actually using PrEP is relatively small. This particular slide shows the ratio of PrEP prescriptions to new HIV diagnosis. As you see in this map, there is still a desperate need for PrEP providers in the South, and the greatest number of providers were in urban areas. However, it is important to note that over half of the US falls in the middle. Now, let's take a minute to get into the meats and potatoes of what is PrEP and what is PEP. So there are 3 components to PrEP. The first is pre, meaning before. In this component, we are referring to before the exposure of HIV. This is the second component of it. And the last component is prophylaxis, meaning prevention or to prevent. So when we think of PrEP for HIV, it simply means to prevent HIV-negative persons from acquisition of HIV. In order to prevent people from getting HIV, medication must be involved. In PrEP for HIV, several medications are currently being used. The first medication is Truvada. Truvada was approved for PrEP by the FDA in 2012. The second medication is Descovy. Descovy was approved for PrEP in 2019. Due to the fact that people born with a vagina were not included in the study, it is not recommended for this population. Unfortunately, there is not enough data to show the effectiveness of medication in this particular population. Also, I'd like to note that these medications do not prevent other STIs. The last and most recent medication approved for FDA is Apretude. This is what is referred to as injectable PrEP. This was approved by the FDA December of 2021, which is less than a year ago. So for some areas, this medication is still not available. This new advance is great because now HIV-negative persons on PrEP don't have to remember to take a medication daily. However, it is important that they must follow up with their provider every other month for injection. Since these medications can impact a person, since all of these medications can impact a person's liver and kidney functions, it is very important that they have a doctor visit every 3 months for creatinine testing as well as STI testing. And that's something that we can talk about a little further down in today's presentation. So jumping over to PEP. What is PEP? It is important to know that this medication must be administered within 72 hours of exposure and taken consecutively for 28 days, Patients given a post-exposure regimen should also follow up with their healthcare providers to complete a panel, including STI testing. If a provider notices that a patient is having a lot of post-exposures, it is wise to recommend them for PrEP. And then also, as you see on the slide, the medications that are used for post-exposure is Truvada and raltegravir. So let's think about who needs to receive PrEP. Anytime I think of this, I think about Oprah when she was just giving out cards to everyone. And so I like to say that everyone needs to receive PrEP. However, there are special populations that are targeted for PrEP in hopes of lowering HIV. Those special populations are MSM and transgender females, males with a history of syphilis or rectal gonorrhea or chlamydia, HIV discordant sexual relationships, injectable drug users, and lastly, anyone requesting PrEP. These are guidelines from the CDC to give us a roadmap on who we should target when it comes to PrEP. They are pretty straightforward, as you can tell. Some of these guidelines are, in order to receive PrEP, you have had anal or vaginal sex in the past 3 months, use injected drugs and have an injection partner with HIV or share needles, syringes, or other drug injection equipment, or you have been prescribed PEP and you report continued risk behavior or have used multiple courses of PrEP. One thing I'd also like to add is that even if the behaviors above do not apply to your client, they still have the choice to take PrEP and they should talk with you as the provider. So as we continue to implement PrEP, oftentimes the biggest barrier is us, the provider. Here are a few questions that I want you to ask yourself for the remainder of the session. Are you the right provider? Are you culturally competent? How educated are you on PrEP? How educated is the client? It is okay if you feel that you may not be the right provider or do not know how to know. It is okay if you feel that you may not be the right provider or you do not know a lot about PrEP. Hopefully today's session will help you to become the right provider. I will also share a list of resources at the conclusion of today's webinar to help guide you on your journey as you continue to learn and grow in the PrEP spectrum. So let's take some time to dissect each of these questions. As the provider, it is important to be culturally aware, meaning how do we address community? How do we provide care? What type of care do we provide? So educated are you on PrEP, meaning how well do you know the medications that are out, as well as how well do you know navigation in order to get a client on PrEP, as well as how to pay for PrEP. And then lastly, patient care. Pleasure P's of taking a sexual history, which is something that we will talk about later, as well as the words that you use when providing patient care. When you hear the words or buzz term cultural competency, what do you think about? How do you describe it? And these are some things that, that I just want you all to think about. Unfortunately, I can't see the chat since I'm sharing my screen, but feel free to, add those comments into the chat. And then here are a few questions that I want you to consider as we discuss cultural competency and why it is important when talking to a client about PrEP or even prescribing PrEP. So thinking about cultural competency, I want you to think about what is it? Why do we need it? what does it do, and who is responsible for cultural competency? What is culture? To break down cultural competency, we first need to be able to define culture. These are some of the things to make up a person's culture. Culture is also a critical definition of culture, refers to shared experiences or commonalities that have developed and continue to evolve in relation to changing social and political context based on race, ethnicity, national origin, sexuality, gender, religion, age, social class, disability status, immigration status, education, geographic location. Why do we need to consider culture? If we have a clear understanding of a person's culture, we will know how to approach them. We will know what words to use and not to use, and we know what kind of apprehensions a person may have as well. It will also drive the outcome. For example, if agency XYZ doesn't have a good reputation with the transgender community, it might be prudent for them to take a step back and do relationship building before tackling PrEP education within this community. So when we think about why do we need to consider culture, here are some of the steps that that I want you to think about, and I won't go through all of those. But just a couple is that culture shapes an individual's experiences with community agency and whether they see them as a viable and accessible resource. Culture shapes access to other services that might be crucial for individual success. When we become sensitive to one's culture, it allows us the opportunity to understand the person or the patient better. We can understand what may or may not offend the patient. It's simply showing that we value and respect our cultural differences. For example, if a person's preferred pronouns are opposite of how the person presents in your clinic, it is important to respect their pronouns. And this is just a rough definition of what cultural sensitivity means. A lot of times when we think about cultural competency, we think that as long as we are aware that we are doing good. Let's take a deeper look into cultural competency. We must accept that our clients will be different than us. They may dress, walk, and talk differently than us as the provider. It is important to accept those things and to be able to provide care. In this case, understand why it is important to get the client enrolled into PrEP care. We must also realize that this is something that will continue to grow and evolve with each client. Why? Because no two clients will ever be the same. So in cultural competency, we must be clear on the awareness and acceptance of differences, understanding of the dynamics of differences, development of cultural knowledge. As a provider, we should always remember to engage consumers and communities to sustain reciprocal relationships. And this is important because we don't want our clients to see that we're always coming to them for something, and we want them to have the necessary buy-in. Take leadership and accountability for sustained change. Build on strength. Know the community, know what works for them. A shared responsibility is creating partnership and sustainability. By taking these steps, we increase the quality of services, thereby producing better outcomes. So in other words, meaning that if we know our community or the population that we want to work with to encourage them to get on PrEP, and they know more about us as a health department or a community-based organization or a service organization, it will create a better outcome because we're all beginning to work towards the same goal and have some commonality. Here are a few takeaways on cultural competency that I would like for us to remember. As a provider, it is very important to identify, use, and/or adapt evidence-based and promising practices, implement specific policies and procedures, developing a mission statement that is inclusive of the community that you want to serve, provide fiscal support, professional development, and incentives for the improvement of culture and linguistic competence at all levels. It is very important to recruit, hire, and maintain a diverse and culturally and linguistically competent workforce. In other words, the community that we are serving want to see the community behind your doors or that they interact with. So it's very important that we maintain a diverse and cultural workforce. As a provider, there are certain things to consider. In order to prescribe PrEP, one, make sure you have a system in place. Two, make sure that you, as the provider, is very well educated, not only on medication, but on the community you're looking to serve. Knowing what the community may already think about PrEP is an excellent way to help combat stigma and to even help the client in certain situations. For example, for a lot of MSM, it is hard to be honest and open about being on medication for PrEP. Why? Because a lot of people think that the person is lying and has HIV. So by having this conversation on the front end, it will help clients on how to begin the conversation and even when to begin the conversation with their partner. So this goes back to the slide that I showed earlier on data. A lot of clients, they are very well knowledgeable about PrEP. However, they are not engaging in PrEP use because of stigma and other issues that may be surrounding access to care. And so these are things that we want to begin to talk about with our clients in the beginning, in their very first appointment, to make sure that they are understanding that we are aware of their concerns. Another key component is knowing how to access programs and how to assist the patient when having the medication covered. An example of this is of an assistance program is Gilead's copay assistant card. And we will talk about PrEP coverage in the upcoming slides. But these are some other things that, that I want providers to just consider to know about PrEP. The science of it, especially the efficacy and the side effects, who might benefit from PrEP, the populations and individuals at high risk for HIV, which is something that we discussed earlier, how to prescribe PrEP, resources available for clinical consultation and education, and then coverage. Another key thing for providers is being able to not only educate the providers, but to be able to educate fellow providers. Like today, everyone should share the information discussed today with a provider that is not here and to find out what could be a potential barrier for them. So these are some things that providers need to know. Educational opportunities, and this is how you can engage them. Hold PrEP sessions during local or regional meetings, meeting with provider organizations, meeting with potential provider groups, for example, HIV care groups, LGBT clinics, sexual health providers, and even public health detailing. Now, just to take a closer look at PrEP coverage. Truvada and Descovy are very affordable for most patients. All insurance plans cover these medications, cover Truvada, most cover Descovy, and they do have variable copays. Medicare and Medicaid does cover PrEP, and as I mentioned earlier, Gilead does have a copay assistance program that offers $7,200 a calendar year for copay assistance, and it does not have an income limitation. Gilead Advancing Access Program also gives full drug coverage if income is less than 500% federal poverty level and primary option for uninsured patients. Another example of a coverage program is called Ready, Set, PrEP, and this is from the U.S. Department of Health and Human Services. There is no cost for a PrEP provider if the patient tests negative for HIV, has a valid prescription, does not have health insurance coverage for outpatient prescription drugs, and this does not cover costs of visits or labs. And this is how individuals can apply for Ready, Set, PrEP online at getyourprep.com or to call the telephone number listed below. As I move towards the end of this talk, it is important to discuss how we engage with patients when they come to see us. Even though the patient isn't positive for HIV, we want to ensure that we are providing optimal care. As we know, having conversations around sex and risk behaviors is very hard to have, not only for the client, but for some providers. Here are a few things to consider. One, emphasize that you ask every patient the same questions. In other words, make a declaration at the beginning of your conversation with your patient. Assure patient confidentiality. Make no assumptions about sexual practices or identities. Allow the patient the opportunity to share that information with you. Thinking about taking a sexual history. First, you want to identify individuals at risk. You definitely want to think about screening appropriate anatomical sites. Provide appropriate risk reduction counseling to prevent future exposure to STDs. And then lastly, the 4 Ps of sexual history taking. Thinking about partners, practices, past history of STIs, protection from STIs. And to go a little deeper into that, some sample questions. One, you definitely want to make sure that you keep your questions open-ended because you want to make sure that this is a conversation and that a person does not feel like they're being interrogated when doing sexual history. So some sample questions for partners is, who are you currently having sex with? In the recent months, how many sex partners have you had? When was the last time you had oral sex? Are you the oral receptive or insertive partner? When was the last time you had anal sex? Now jumping to the second P, which is on practices, some sample questions are, when was the last time you used or shared needles for drug use? When was the last time you got tested for STIs, including HIV? When you get tested for STIs, have you ever had a rectal or pharyngeal swab? Thinking about past history, when was the last time you tested positive for an STI? If so, which ones and where was the infection found? How often do you use condoms or other barrier methods for vaginal, anal, or oral sex? The things that we want our clients to know about PrEP. We always want to make sure that we are educating our clients about what PrEP is. We want to make sure that our clients understand the efficacy and the potential side effects of PrEP. We want to make sure that our clients know who could benefit from PrEP. By doing this may help them to kind of learn and to educate some of their friends or their partners on the benefits of PrEP. And we definitely want our patients to know where to find PrEP. I can't remember the name of the site, but there is a PrEP locator, and I believe it is found on CDC's website, but I'll definitely share that information that has a PrEP locator. And then lastly, we want to think about paying for PrEP. How much does it cost and what happens if you can't afford it or if you do not have insurance? So these are things that we want to make sure that we're having the conversation with our clients as we discuss PrEP and ensuring that it is appropriate for them to take. Reaching potential PrEP clients. Things that we want to do, you want to engage into direct marketing, and then making sure that that marketing is taking place on mobile applications or any social media websites such as Facebook, Instagram, or Twitter. Earned media, especially in LGBT-focused outlets. Editorials or letters to the editor. HIV prevention planning groups or Ryan White councils. Medicaid advisory boards, community forums, Pride, and other community events. Who can identify PrEP candidates? We must realize that we cannot do it alone. When it comes to identifying PrEP clients, it is important to partner with others. And here are some people that we definitely should partner with whenever we're thinking about candidates for PrEP. Disease intervention specialists. They're ideally situated to identify persons who might benefit from PrEP. From doing direct assessments of PrEP need benefits at the time of partner services. Review registries lists of persons treated for STIs. So for example, MSMs with rectal bacterial infections or early syphilis, they could benefit as PrEP candidates. Other outreach staff based in the community, such as patient navigators, health educators, or youth educators. Potential locations for identification and referral. Publicly funded STI and/or HIV settings, outreach for emergency rooms and urgent care settings providing PEP. So this is not a comprehensive list, but this is just some of some of the things that we could do. And when it comes to thinking about how we can identify PrEP candidates in your local area. Lastly, this is a resource guide that I would like to share. This also is not comprehensive, but this is where I found a lot of the information that I shared with you today on PrEP and PEP, and I hope that it will be information that you can use and share. And then lastly, this is my contact information. Please feel free to reach out to me via email if you have any additional questions for me that are not addressed today, and I will be happy to answer those. And at this time, I will turn it back over to Bailey, and we can look at the chat for any potential Q&A questions.
Awesome. Thank you, Leo. Let's see. Please send any and all of your questions either through Q&A or through the chat box. Either way, we will get them. I do see one question here. Can you speak to some of the potential side effects of PrEP and PEP?
Yes, one of the most common side effects oftentimes is liver and kidney dysfunction. So that is why it is very important that individuals who engage in taking PrEP, that they do go to their medical provider, do those 3-month follow-ups so that they can do creatinine testing. Outside of that is one of the most important side effects. The other side effects, are things that could consider, diarrhea, fatigue, fever. But those things are usually things that are at the onset of beginning the medication, and it usually subsides. But it is very important that patients who begin a PrEP regimen, that they follow those 3-month guidelines to engage into getting creatinine testing.
Awesome. Thank you, Leo. I do see a question in the Q&A about the PowerPoint. Yes, that was sent with the event details, but I can make sure that it's sent with the email that'll go out after this as well. Let's see. Do we have any other questions? Again, you can send it through the chat or the Q&A. Either one is fine. All right, well, I've always heard that you're supposed to wait 7 seconds to see. Oh, and it worked. Okay, all right, we got a question. So how effective is PrEP ID users? And are there any recommendations on PrEP use among IDU?
I don't know the effective percentage right off the top of my head. However, it is effective. As I mentioned earlier in one of my slides, IDU, or a person who inject drugs, is one of those potential populations that we want to make sure that we are engaging PrEP usage in. I'll be happy to look that data up and just share it with Bailey after today's conversation.
Awesome. And there was a second part to that of any recommendations on PrEP use among IDU.
I want to make sure that I'm understanding that clearly. So if I don't answer this correctly, please feel free to clarify. But recommendation is that it is really recommended for IDU users. I think that the biggest thing is making sure that which medication works best for them, and then working with the provider to ensure that the person is adhering to the medication. Because one of the things that we think about with IDU users is that some of them may be transient and they're not able to always make provider appointments. So those are just some things to consider whenever you're thinking about IDU users.
All right, it looks like we got lots of questions coming in now. Here's one in the chat. What advice could you provide about having PrEP conversations with women, since they typically fall outside of the traditional target groups?
I think one of the things that I would definitely stress with women is that PrEP is for everyone. It is their decision, especially women who are considered high risk. And then also I would want to have a conversation about their partners, making sure that, that there's a clear understanding that we may not always know the sexual history or the sexual activity of our partners. And so thinking about it, taking it from a conversation about risk reduction, I think would be a good mechanism.
Awesome. Let's see, we got some more here in the Q&A. Since the injectable PrEP is fairly recently approved, do the financial assistance programs extend to that, or is it only for Truvada and Descovy?
That is a good question. And upon my research, because it is so new, I was not able to find anything on that. To be honest, I don't think that anyone has begun prescribing because it just was approved by FDA at the end of 2021. And I think that most people are probably going to begin prescribing it probably around the end of 2022 before it actually goes into use. And one of the reasons being is to work out some of those things about cost and ensuring that it is equitable to everyone.
Thank you for that. Let's see. For the shots for PrEP, is that a common form? Also, after the 2 shots, how long is it good for? And do they have to go back and get another shot?
Yes. So the shot is new. As I just mentioned, it was approved by FDA in 2021. So it is not common. The most common form is the pill form. The 2 shots are the initial injections, which are given 1 month apart. After that, the injections are given every other month. And so if you look at it that way, after the 2 initial injections, the person will receive an injection every other month or 6 times a year after the initial injection. And the thing about the medication is that it does contain, it is kind of like it slowly releases over time, so that you keep the same level of medication in your body between appointments.
Great, thank you. Let's see, do we have any more questions? I don't see any more in the Q&A or the chat. So feel free to send those in. Here's one. Is it okay to take PrEP if a client is on birth control?
Yes. And with that, also thinking it is okay if a person does use alcohol and they're on PrEP also. One of the things that I would add on that though is that, you know, alcohol usage as well as drug usage, it won't impact the medication, but sometimes it will. What I like to say is may make a person forget to take the medication, so they may not stay on their regimen as they should, but there is no contraindications with birth control or alcohol.
All right, we've got another one. So several clients of mine are on hormone therapy. Are there any risks or side effects that I should make them aware of?
There aren't when it comes to PrEP. We oftentimes encourage that kind of be a vehicle to begin the conversation of PrEP. You know, like some clients or some clinics um, offer hormone injections, and so that is kind of like a way to begin the conversation about PrEP. But there are no indications where it will where hormone therapy could impact the use of PrEP medication.
All right, I'm gonna take a look again here at the Q&A. Yep, we've got some. So is adherence to the medication higher in the shot versus the daily pill?
There has not been enough studies to know the adherence around the shot versus the daily pill, only because it is relatively new. However, what I would add with adherence to the daily pill is that adherence is really high with that particular with the pill. So I would imagine that the adherence for the shot would be equally as high because it is something that you're not having to do on a daily basis. And then also, since we're kind of talking about that, Bailey, I see in the chat about routine liver and kidney function with injectable PrEP. Yes, that is also required.
Okay, I'm gonna do the 7 seconds to see if we have any more questions. All right, I'm not seeing any more in the Q&A or the chat. So we have a few more things, just housekeeping things to go through here at the end. So if you have a question pop up in that time, feel free to put them in the Q&A or the chat. But other than that, I think we're gonna go on to some housekeeping things. Thank you, Leo, for all of the Q&A answers. All right, so let's see. All right, so thanks again to Leo and everyone for attending this webinar. There will be an evaluation link sent via email after this webinar concludes. You can also scan the QR code here on the screen. We greatly appreciate your feedback. We use all of that to better our trainings and webinars in the future. If you enjoyed today's presentation and would like to learn more about STI and HIV prevention, hope you consider visiting HCET Virtual Learning at learn.hcet.org. There's new learning opportunities being updated there regularly. And I'm going to check the chat again. All right. So with that, I'd like to thank you all for attending today's webinar, and we can go ahead and conclude. So thank you so much and have a great day.